I normally start my talks to distinguished health audiences with a story about the argument between the doctor, the engineer, and the politician as to which was the most important for the future of humanity. And the doctor says, well, of course it's us doctors. Without us doctors, how would mankind have survived all these millennia? To which the engineer says, yes, but without us engineers, who would have created order out of the chaos? To which the politician smiled and said, yes, but who created the chaos? And I'm sure that Kathleen Sebelius and I would say that on both sides of the Atlantic, this is something that politicians are regularly accused of. As Brian said, I started this job last September. And I said at the time it was the biggest privilege of my life. And I think working in healthcare, in any aspect of healthcare, is a huge privilege. We have 1.7 million people who work for the British National Health Service, either directly or indirectly. Bill Clinton once said that politics is like working in a graveyard. There are lots of people underneath you, but they're not necessarily listening. And it sometimes does feel like that. The NHS is actually the 5th largest employer in the world. The 4th largest is McDonald's. The 3rd largest is Walmart. The 2nd largest is the Red Army in China. And the largest is the US Department of Defense. So guys, if you start accusing me of socialized medicine, I might have to talk about socialized defense, because this Department of Defense is absolutely huge. I want to just make a comment following Secretary Sebelius's comments, because it isn't for me to get involved in a US domestic political debate, but I want to salute the aspiration for universal coverage of healthcare. This is an incredible thing. I was with Secretary Sebelius in Geneva a couple of weeks ago at the World Health Assembly. And you know, the whole world, from Africa to Asia to South America, they are looking at what is happening in the US. And they're making a call. They're making a call as to whether universal coverage should be something that every country in the world aspires to. And I think it should. And I think what's happening in the US is showing great leadership, and I think is incredibly inspiring. So I want to say that. And I also want to say that although our systems are very, very different, we share some challenges in common. We share the challenge of an aging population. My daughter was born last year, and I checked on the statistics. She has a 1 in 4 chance of living till she's 100. I have a 1 in 10 chance of living till I'm 100, and I think a lot of people here are somewhere in between those two, judging by the young faces here. But this is a big challenge for all of us. And on top of that, we have the challenge of affordability. And that particularly relates to the prevalence of chronic conditions. In the UK population now, a quarter of the country, a quarter of the population has a chronic condition. And this has a massive impact on healthcare costs and healthcare affordability. And a lot of the revolution that we were hearing about from Steve and Bob is about rethinking the way that we deal with chronic conditions. And I think one thing that unites the UK and the US is our shared belief in technology and how that can be totally transformative. I know that Brian is an entrepreneur in residence. And I actually feel, as a British cabinet minister, one of only 2 actually who set up their own business as an entrepreneur in residence in the British government. And some people say, what's the difference between business and politics? And I did hear it once said that the difference is that in business it's dog eat dog, and in politics it's the other way around. And but there's been a huge amount of things that have been happening that have shown the positive power of business, particularly the technology industry, to transform healthcare. And you've got the High-Tech Act here, which puts health technology at the heart of US health reform. You've now got, I think, more than half your office-based physicians doing e-prescription, nearly half your hospitals using electronic health records in a meaningful way, and of course, the important role of interoperability in the ACA. So these are very important changes, but I want to lay down a challenge as I see the two flags of our countries there, because I want to suggest to you that when it comes to healthcare innovation, the most exciting, the most entrepreneurial, the most transformational things may in fact not be happening here, but across the Atlantic in the UK. And we think that there are some really, really big changes that are going to be essential to reforming healthcare going forward, and technology is right at the heart of those. We think there are really three stages. The first is what Datapalooza is all about, which is the power of data to be completely transformative in terms of the way that we all learn and improve the healthcare that we receive. That's stage one. The second stage is transactional. It's the ability to book appointments, whether it's with doctors or hospitals, whether it's to order medicine prescriptions online. The transaction stage is stage two. And then the third stage, which is really the most important of all, is actually to put patients in the driving seat of their own healthcare. And that is really what is at the heart of this. Now, let me tell you 6 things that are happening in the UK, which I think will help us really embrace that revolution. The first is around electronic health records. In the next few years, we will have 50 million health records online. That is the entire population of California and Illinois combined, completely comprehensive. And that will mean that you can access any part of the healthcare system, and with your consent, doctors will be able to see your entire medical history. That will be completely transformative. It'll also be a huge source of research, because the second thing that we're doing in that same time period is we are going to be sequencing 100,000 genomes, the biggest concentration of genome sequencing anywhere in the world. This goes back to our history, our terrific history in life sciences, going back to Watson and Crick in 1953, unlocking the secrets of DNA. Well, we want to, concentrating initially on cancer and a few rare diseases, unlock and sequence 100,000 genomes. Now, if you match that genome sequencing against someone's medical history, and you look at someone, for example, who has bowel cancer in their 70s, and look at what was happening in their medical history in their when they were in their 40s and 50s, you can unlock a huge amount of incredibly important information. And this will be, we think, as significant as the founding of the internet, when people came together in that unique constellation of events. We think the sequencing of genomes, electronic health records, put those together, and there will be a total transformation of the whole healthcare agenda. On top of that, we have had the world's largest study of the impact of telehealth and telemedicine. And our research in our whole system demonstrator indicated a reduction in mortality rates of over 40% and a reduction in emergency admissions of 20%. And we want to have 3 million people using telehealth, telecare in the next 3 years. It's a very big ambition. It'll make us the second biggest telehealth market in the world after the US. So that's the third one. Then we have something called Care Connect. Now, US citizens will know how 311 works in United States cities, and how municipalities are using this to transform public services by getting data from the public about how they're experiencing services and where things are going wrong. We want to be the first country in the world that does that for health. And today I can announce that we'll have 2 pilots, one in London and one in the northeast of England, which will be called Care Connect. And these will be using the power of what patients are saying about the healthcare services that they receive in order to help us to improve those services for their benefit. And then we have the patient voice, the power of the patient voice. We had a terrible tragedy in the UK where we had a hospital in Staffordshire that where there were the most appalling examples of cruelty inflicted on patients. And we want to learn from that. And one of the things that we're doing from this year for the first time in all 266 NHS hospital trusts, every single inpatient will be asked whether they would recommend the care they receive to a friend or a member of their family. And that data is all being published online. And critically, what we are discovering is that if you ask the staff in hospitals whether they would want their own friends and family to be treated in their own hospital, that is a very good lead indicator as to whether there are problems in the quality of care that are being received. So that is a very big program. The final thing, which I think is incredibly exciting, is what we call our eye doctor program. We have massively improved the quality of our heart surgery in the UK by collecting data and publishing data about the survival rates of all our heart surgeons in England on a risk-adjusted basis. And as a result, we have become one of the top-performing heart surgery countries in Europe. And we're now going to roll that out across 10 other specialties, including cancer, bariatric, vascular, and all that data by a consultant team, by individual surgeon, will be published so that we can identify outliers and drive up standards in clinical practice. And I think that is going to be something that is totally transformational. Now, the hard questions you can ask is, first of all, can we afford this? To which we believe, and I know you would agree with me, that doing this is actually the key to making good universal healthcare affordable. This actually drives down costs when you get it right. And so this is an investment that we have to make. Then there's the argument that technology works for younger people, but less so for older people. To which I would say we should never underestimate the ability of all generations to embrace the power of the internet. In the UK, a quarter to a third of all over 65s do all their banking online. And the banks, incidentally, have reduced their retail banking costs by a third as a result of this. So this is something that everyone can embrace. And then the final argument that we sometimes get is you shouldn't be spending money on computers, you should be spending money on doctors and nurses. And again, I would say this isn't a choice. It's not a binary issue of where you spend your money. Spending money on proper IT systems means that our nurses are not having to spend 2/3 of their time filling out paperwork in emergency departments. And it actually means they can spend more time with their patients.